Here for another episode in the concussion series. And in this one, what we're going to be talking about is I've hit my head, and now I start to question myself and ask, should I go get imaging done of my brain to have a better understanding of what's really going on? My name is Dr. Matthew Shim, and I am the owner of Peak Brain Performance Centers located here in beautiful Colorado Springs. And the question of today is to image or not to image. So in this study, what they found was that in the vast majority of patients with mild traumatic brain injuries, immediately after their injury, on CT scan and MRI, their scans appeared to be normal. However, they did find individuals who showed presence of hemorrhage, hematoma, contusion, or diffuse axonal injury, which falls under the category of more moderate to severe traumatic brain injury. So I think this article does a pretty good job at painting an overall picture for you to be able to ask the question, should I go get imaging done after I've hit my head? And the answer is, well, probably, because it's not a bad idea to have some of these larger things ruled out and managed before you come and see somebody such as myself. I also understand how it can be frustrating for you as the patient, because the reason that you even went to go get imaging, unless it was forced upon you, the reason that you would go do that is in search of answers, right? And so I understand how it can be frustrating for somebody to come back to you and say, well, your scans appear to be normal, and now you're just leaving with the same amount of questions that you had whenever you initially got the scans done. So the reason for that is that whenever you have these scans done, whether it be CT scan, MRI, something like that, they're looking for more structural damage. And the problem with this is that whenever you have a concussion is a functional injury. And so with that, if you remember some of the prior videos that we've done, is when you have a concussion, it's a functional injury in the fact that these pathways are just stretched, but they stay intact, okay? And so there is no true structural damage that occurs. So unless you were to do some sort of functional imaging, such as a SPECT scan or an fMRI, you're probably not going to see anything. So what does the literature say about this functional imaging? Well, this article says that although patterns of abnormal imaging are commonly observed in the studies of persons with neurologic or psychiatric conditions, when compared to normal individuals, these patterns are generally not specific to any one condition and instead demonstrate considerable overlap with one another. So basically what that means is that whenever you're doing these various functional imaging, such as a SPECT scan or fMRI, how they're measuring these imaging modalities is they're measuring it based off of blood flow or oxygenation going to a particular region. Okay, so if I want to use a particular area of my brain, I have to fuel that area of the brain to be able to complete the intended task, right? And so basically in this article, they even gave examples such as headaches, migraines, anxiety, depression, traumatic brain injury, all these different subcategories of conditions led to a increase in blood flow or oxygenation to a certain area of the brain. However, it's not specific to one particular condition. So to just wrap it up, I think if you were to ask, should you go get imaging done after you hit your head? The answer is, especially if it's acute, so it was more recent, you should probably do it just to be able to rule out some of these larger things that are more pertinent to being managed immediately. However, if it's months or even years later, it's probably not as important. And if you were to do something in the realm of a functional imaging modality, is it necessary? Probably not. Is it cool? Sure. But it inevitably it comes down to what is going to give me the best diagnosis, which then leads me to be able to make the most appropriate care plan for you and your particular injury. And if these various functional imaging modalities don't actually give you one complete diagnosis, then is it necessary? That's up to you to decide. Thanks for joining today's class. If you want to reach out to my office, you can email me or give me a call. Other than that, if you have any other topics that you think would be cool for me to discuss, go ahead and drop that below and I'll take a look at it and we'll get a video recorded for it. Other than that, I hope you have a great day and I'll see you in the next one.